UW veterinarian Sandi Sawchuck is here tonight to take your pet questions, and Sandi has brought along some friends to show us tonight.
Friends to look at you. Who do we have here? Hi.
I brought some of my friends and their guinea pigs. You know, guinea pigs make wonderful pets. I've had them as a child. My daughter had one who lived to be about 8, and he just passed away recently, Leroy. But with G-Force, the Disney movie coming out, you know, they've really become popular as pets. Everybody thinks that, you know, because in the G-Force movie, they can fly and use flamethrowers and swim and jump off of buildings and so on. That's not the guinea pigs that I know, okay? They do require a lot of care. They can make a little bit of noise. They have very special dietary needs. They need big cage spaces, and they really need to be kept clean, and they're very social, as you can see as my two friends here with their little guinea pigs.
Caden is feeding him a carrot right now. And Nikki, yours had one too, right?
Right.
And what are their names here? These are all your guinea pigs. Who do I have?
That is Puffin.
Puffin,
and this is Robert down here. And this is Shadow, right? Shadow. And Rosalina. Okay,
Very
those
nice.
are great names.
Very nice.
Although Rosalina is a boy, so
okay.
yes, but that's okay.
So you need to think, though, before you just go to the pet store.
You have to do your homework, and they're not meant for young children.
You know, that's good.
Someone like this age, that's great, but you know what, little tiny kids,
They're awfully cute.
Thank
you for bringing them in. You want to stick around while we take some phone calls? Why don't we do that?
That's a good plan.
And we'll start with Clara in Monroe. Hi, Clara. What's your question? Clara, can you hear us?
Hello.
Clara?
Let's see. Let's try this again. Clara, can you hear us?
Hello.
Hi. Sorry about that. What's your question?
I have a cat, and he's about 17 pounds.
Wow.
And I've had him for a few years now, and just recently he started urinating on my sofa.
Oh, well, I tell you what, first thing you're going to want to do is make sure that you take your kitty to the veterinarian to have him checked out. Being 17 pounds, that's a little big, and he could potentially have something like diabetes, which is making him make more urine, and he can't make it to the litter box. So get a clean bill of health first. After he's had a clean bill of health, then we start looking at behavioral reasons, such as he can't make it to the litter box because it's down in the basement and he's just too big to move down there, or maybe you're not keeping it clean enough. Lots of different things like that. So initially, call your veterinarian, get him in, and make sure he goes in with a full bladder. I know that's kind of hard for cats, but we need to be able to get some urine from him as part of the exam.
Good advice. All right, let's go to Aaron in Madison. You have a question. Hi, Aaron.
Hi, I have an 8-week-old puppy, and he is biting my husband and I, and with all the nose and the redirection, he thinks it's this huge game. So I was wondering if there's any other techniques we could use.
Well,
what breed is he?
Pardon?
What breed of puppy is he?
He's an English bulldog.
Oh, sorry, Sandy. I
There
didn't mean to
you go.
interrupt. I
Okay.
just heard the puppy, and I went.
Well, you know that's like I'm very passionate about the breed, but he is a baby, and just like young children, you have to be a lot of repetition. Maybe after 50, 80, 100 times, he may suddenly have a little light go on and go, oh yeah, I'm not supposed to do that. So you're doing the right thing by redirecting him. If you're saying no, there should always be a yes accompanied with it, what you want him to do. Get him enrolled in training classes as well, because that's so important that he learn the right thing to do. So, you know, I think that he's just 8 weeks old right now. Play with appropriate toys. Always have something that you can substitute into that little mouth of his so he has something to bite on besides human flesh.
Oh, I bet Dozier was adorable at that age. Sandi Sawchuck and her friend Puffin are here today. We're taking your calls at 270-9933. Let's go back to the phones, and we'll talk to Mary in Madison. Hi, Mary. What's your question?
Hi, Susan. Hi, Mark.
Hi.
Dr. Sandi. I have a 10-year-old female Maine Coon, and I noticed that she has like a mole on the back of her ear. Do you ever see cases of skin cancer, Dr. Sandi?
Yes, we do. Question. That's a very good question. In fact, in some cats, especially cats that have white ears, if they spend a lot of time out in the sun, they can get a type of cancer called squamous cell carcinoma on their ears and on their nose. But we see other types of skin cancer in cats as well, mast cell tumors and basal cell tumors and so on. So I think it would be a good idea to get your kitty in, because it may be something very minor, but the earlier you catch it, the greater the chance for a successful treatment. So in to have it looked at, and it's really easy to get a diagnosis. We just put a little needle in it and put the cells on a slide and have a look. So
great question.
Non-invasive.
Good. Let's talk to Patty from Endeavor. Hi, Patty.
Hello.
What's your question?
Hi, Sandy.
Hi.
Yes, I have a question for my diabetic dog. I have 5 miniature pinchers, one of which is diabetic, and they're all rescues. I saved them from puppy mills. But anyway, when everybody gets a treat, I can't give her one. And I was wondering if you know where I could pick some up, or what would be a good treat.
Well, that's a really good question, because diabetic dogs do deserve a treat once in a while as well, and you just don't want to throw their whole insulin cycle off. And so I'd be using something very high in fiber. And so your veterinarian could make some recommendations, but a high fiber treat would be perfect. Sometimes what we'll do is even take the same canned food that they're on in the canned variety, and you can just bake little spoonfuls of it and make kind of little soft, crunchy, biscuity type things, and use that as a treat as well. You just want to stay away from sugary things and high protein.
Well, especially if the other puppers are getting a treat. You
It's
have to
gotta
get
be
a
fair.
treat.
That's right. That's right.
Let's talk to Fran in Madison. Hi, Fran. What's your question?
Yes, I adopted a cat from the Humane Society that had roundworms, and she's been treated twice for them and found that she did not have them anymore, but she still has a big tummy.
Well, that tummy may be big because she's overweight, so that would be something that, again, looking at the rest of her body, does she have extra fat over her rib cage and over her backbone and so on? But if she's just got a big belly and is thin everywhere else, there's other things that can cause that. There's a disease that cats can get called FIP, feline infectious peritonitis, that can cause fluid accumulation in the abdomen as well. And again, if she's not feeling well, that would be something to be, having looked at by your veterinarian. It may be nothing more than she just needs to go on a diet, and that would be very nice if that's all it is. Yeah.
Maybe we have time for one more question. Roger from Edgerton. Hi, Roger.
Hello, are you there?
Yes.
We're here. Go ahead.
Hi.
Okay, we had a family pet that passed this last Friday.
Oh, sorry.
He's a family cat, and he's running through the house like he always does, and he just collapsed and he slammed in the end table.
Oh, my goodness. Yeah.
Can cats get aneurysms and heart attacks?
Cats can get heart disease. We typically don't see aneurysms or true heart attacks like people get, because cats don't get hardening of the arteries like we do. But they do get heart muscle problems called cardiomyopathy, and that can cause acute death. And sometimes they'll actually shower clots to their brain and other parts in their body that can cause them to die acutely. I'm very sorry for your loss. One thing that the owners that lose pets like this may want to consider, just to help with closure, is having an autopsy or a necropsy done. It really does help give closure and answers questions so they don't feel guilty the rest of their life that this is something that I missed.
That's good advice. Very good advice. We're all out of time, unfortunately.